Hello, everyone. This is Jen Frazier. I want to welcome you to Decriminalization and Descheduling, the current state of legislation. First of all, I want to wish everyone a happy 420. I hope you're all enjoying your day, and we'll go ahead and get started without further delay. So we know that cannabis, most of us are probably aware that cannabis has a long history of successful use in treating medical conditions. We also know that politics and greed led to the criminalization over the course of the 20th century. Our association, the American Cannabis Nurses Association, believes that the time has come to deschedule and decriminalize cannabis based on the current science. And before I go any further, I just realized I failed to do a little bit of housekeeping duties. First of all, if you have questions, please leave them in the chat. And at the end of the presentation, I will take a look and I will answer your questions. Second of all, I have everyone muted, but feel free to communicate in the chat other conversation if you like. I don't have a problem with that. I do have myself blocked out so you can't see me because I will be reading some notes and I don't want it to be distracting to you. So we'll continue on from there. So as I said, we believe that it's time to decriminalize and deschedule cannabis. We did a survey in 2019 that reflects the following facts: that our association members support descheduling cannabis at a rate of 67%. And 29% support at least rescheduling it within the Controlled Substance Act. The American Cannabis Nurses Association is aligned with several other organizations wishing to see changes made to the current legislation. Some of those that I've highlighted on the slide are the American Nurses Association, the Americans for Safe Access, NORML. Some others that are not included on the slide include Patients Out of Time, the American Civil Liberties Union, the Libertarian and Democratic Parties, Society of Cannabis Clinicians, Doctors for Cannabis Regulation, and the Drug Policy Alliance. I would be remiss in not stating that we also have folks who are adamantly opposed to legalization of cannabis. That includes law enforcement, police unions, pharmaceutical companies, Abbott Laboratories specifically, the American Medical Association, the American Society of Addiction Medicine, the American Academy of Child and Adolescent Psychiatry, and the American Academy of Pediatrics, Drug Free American Foundation, and the Republican Party. So what is the current state of cannabis? We all know it remains illegal at the federal level. There are over 60 bills presented in our current legislation session. 3 bills are of primary interest to us, and we will look a little bit closer at those 3 bills. As of the creation of the slide, there were 37 states, Puerto Rico, and the US Virgins that have legalized medical cannabis. There are 18 states, the Washington, D.C., Guam, and North Mariana Islands, have legalized both medical and recreational. According to Pew Research, Americans overwhelmingly support the use of medical cannabis. So I want to discuss a little bit about the impact of the current illegal status of cannabis. Research is the first tenet that I want to discuss. So being a Schedule I drug impedes the advancement of research in the United States. It has created massive gaps in our scientific research. Israel and Spain are actually quite progressive, and we are seeing quite a bit of promising research coming from those countries. So I encourage you, if you're looking at research, to not be afraid to go outside of your research conducted in the United States to support medical cannabis. The Federal Drug Enforcement Agency currently controls all sources of cannabis used for research. If you want to conduct research using cannabis in the United States, you first have to apply for approval from the National Institutes of Drug Abuse and the DEA, Drug Enforcement Agency. You then have to obtain a Schedule I license and request cannabis from the University of Mississippi, the only DEA licensed cannabis cultivator in the United States. Now, on March 20th of 2020, the DEA made a big announcement that they were going to open up the research gates. They were going to approve more producers of cannabis to provide cannabis for research. They also made a big announcement in September of 21 that they were going to expand the cultivators and loosen up the regulations. We really haven't seen anything other than their big announcements. There was one other company, and I'd be remiss, or one other, there was one company who was given permission to provide cannabis specifically to the University of California, San Diego for a study on essential tremors back in 2018. That company happened to be Tilray, a Canadian grower. Since that time, we still have not seen any forward movement from the DEA. So when we have such limited ability to access cannabis from anyone other than the Mississippi, we are neglecting to recognize that cannabis has been cultivated, and we have a lot of chemo variants of cannabis at this point. And we also know that cannabis, based on chemo variants, have different impacts on the human body. So without loosening the tight hold that the DEA has on research, we cannot truly get quality research from American studies. When we federally deschedule, this would remove the barriers and the hurdles that researchers are currently trying to navigate in order to conduct research. Education is the next aspect. So the National Council of State Boards of Nursing published the NCSBN National Nursing Guidelines for Medical Marijuana in 2018. And as we know, they had 6 principles of essential knowledge related to cannabis therapeutics. They believe that nurses should have a working knowledge of the current state legislation, legalization of medical and recreational cannabis. Sorry about that. Legalization of medical and recreational cannabis use. They should have a general knowledge of the principles of the medical marijuana program. They should have a general understanding of the endocannabinoid system, cannabinoid receptors, cannabinoids, and the interactions between them. They should also have an understanding of the cannabis pharmacology and the research associated with medical use cannabis. They should be aware of faculty and agency policies regarding the administration of medical marijuana, and they shall not administer medical cannabis to a patient unless specifically authorized by jurisdiction law. So several surveys were conducted among various healthcare professionals, and it revealed that the majority are still not receiving adequate education in their coursework regarding cannabis therapeutics. And one study actually revealed that pharmacists appear to have the most in-depth understanding of cannabis, but not nurses or physicians. So federal illegalization of cannabis means that institutions of higher education must monitor, enforce, and sanction any student or faculty that violates what's called the Drug-Free Schools and Cannabis Act, or Campus Act, excuse me, of 1989. So what this does is it's a regulation that requires school teachers to teach students and faculty, sorry about that, guys. It requires schools to teach students and faculty the dangers associated with illegal drugs. Well, as long as cannabis remains on as a Schedule I and is classified as an illegal drug, they must teach the dangers of it. Teaching that it can be used as a primary treatment or an adjunct to other medical therapies could be construed as illegal. And in doing so, the institution could have all of their forms of financial assistance terminated by the Secretary of Education. Now, no one has challenged this at this point, and I know that there are schools that are advancing in their position and teaching about cannabis in nursing and medical or physician programs. But the predominant feeling out there is, well, until we have enough research and it's legal, we don't want to touch that. Let's talk a little bit about social justice and inequities. So the primary tenets of social justice and equity in cannabis prohibition include lack of access, cost, a disproportionate impact on minorities, and the unfair impact of criminalization. The average cost of incarceration for one inmate was over $36,000 in 2018. It cost taxpayers $80 billion annually to incarcerate nearly 2.3 million prisoners. The total state spending on correctional institutions was approximately $42.1 billion in 2016. So according to the American Civil Liberties Union, 43% of all drug arrests were for cannabis, and 89% of those were simply for possessing cannabis. Blacks are 3.64 times more likely to be arrested for possession than whites, even though the rates of use are the same, even in the states where cannabis has been legalized. Any legislation passed must address inequities that prohibition creates. And that's why we stand for decriminalization of cannabis. Federal decriminalization would address the social inequity faced by individuals in non-legal states who are unable to readily access medical cannabis. And if caught in possession, they face criminal prosecution. According to a survey in 2019 completed by Americans for Safe Access, 70% of medical cannabis patients believed their medicine was unaffordable. Nearly a quarter of them stated that it was so cost prohibitive that they needed to go without their medical treatment. They also cited that state enrollment programs were prohibitive. In Washington, it cost $1 to apply for a medical card. And in Arizona, $350. This is in addition to the cost of a healthcare provider appointment. Federal descheduling would reduce the cost of medical cannabis for over 4 million patients enrolled in medical programs throughout the United States. The last impact that I want to discuss is safety and quality. The current state is a patchwork of state regulations. Interstate commerce regulations will need to be addressed, as will regulatory oversight at the federal level to ensure safe products, free of contaminants and false or misleading product ingredients. And I'll talk about that a little bit more when we talk specifically about the MORE bill. So let's move on to speaking about some specific legislation. So we're all familiar with the Marijuana Opportunity Reinvestment and Expungement Act of 2021, known as the MORE Act of 2021. It passed the House, it was presented to the Senate on April 4th, and it was referred to the Finance Committee. I've been unable to find any more information about it beyond that at this point. I have reached out to my legislator or my senator to see if I could get more information about the status of that. And I can provide an update once I have that. The second bill is the States Reform Act, introduced on 11/21, and it was referred to several committees, last referred to the Health Committee on 1/22, and no additional action was taken on that. We also waiting in anticipation for Senator Robert Schumer of New York to release the Cannabis Administration and Opportunity Act in the Senate. He was going to do that beginning of April, and then he has been recently announced he would be releasing that toward the end of this month. So let's take a little bit closer look at first the MORE Act. So the MORE Act essentially decriminalizes and deschedules cannabis at the federal level, including removal of it as a scheduled drug under the Controlled Substance Act. It removes criminal penalties for all aspects of cannabis, from manufacturing to possession. The following additional changes are included in the bill. The Department of Labor will begin to publish data on cannabis-related business owners, employees, and the cannabis job market. Funding will be made available to help those negatively impacted on the war on drugs due to cannabis-related offenses. Certain cannabis-related conduct or convictions will no longer prevent individuals, including immigrants, from being able to access federal public benefits. Furthermore, immigrants will not be denied immigration protection laws. Cannabis will be taxed at the federal level, bringing in the needed funds to help with our ever-growing federal deficit. Banks will be able to provide services to cannabis-related businesses. Small business loans will be made available to cannabis-related businesses. A process for expungement of convictions and conduct sentencing review hearings for those prosecuted for federal offenses will begin. And the Government Accountability Office will be required to study the impact of cannabis legislation on society. So let's talk about what the MORE Act doesn't provide. The MORE Act does not provide the structure needed to ensure safety and quality, but rather leaves the patchwork of regulation and level of legalization up to each state. This is the key aspect that nurses must consider for their own self when determining if they will support or oppose current legislation. So let me say that again. When you're considering opposing or supporting the MORE Act, you need to consider both sides of what what is positive about the MORE Act and what's not positive about the MORE Act. The Cannabis Administration and Opportunity Act, we don't know a lot about that bill yet. A letter of intent was sent, presented to or submitted to Nancy Pelosi at the end of January, and he invited fellow senators from both parties to collaborate in creating the bill. And as I stated before, we have not seen that bill yet. There is one last bill that I do want to bring to everyone's attention. It's House Bill 5977. It's the States Reform Act introduced of Nancy Mace of South Carolina. She introduced this bill in November of 2021. It would remove cannabis from the Schedule I Controlled Substance Act and place regulations under the Food and Drug Administration Act and the Department of Agriculture. It includes provision for federal taxation, commerce, both domestic and international. It has a provision for expungement of criminal records for nonviolent domestic cannabis-related charges, excluding driving under the influence charges. However, the bill does not provide reparation for individuals or communities impacted by the war on drugs. The bill does not correct the misuse of the words marijuana and marijuana in both spellings in the current government documentations. Instead, it intermixes these terms with cannabis, which can lead to further confusion. The bill has not attracted public's attention, and it has not garnished the same amount of co-sponsorship on the MORE Act. And at this point, I'm going to pause. If you go to congress.gov, you can look up any bill you want. And if you want to know what's out there for cannabis-related bills and to read what's happening to any of the bills I'm discussing, you just put in the word cannabis in the search, and it will pull up everything you could ever imagine. And there's filters on the one side that you can click on and off to help you narrow down to what you're looking for. So I want to talk a little bit now about why descheduling and not rescheduling. Our current legislation, there is one bill that is proposing rescheduling, and that is House Bill 365, the Marijuana 1 to 3 Act. Basically, it just removes the schedule, transfers it to a Schedule 3. And as we know, Schedule 3 is described as a drug, substance, or chemical that has less potential for abuse than Schedule 1 or 2, that has currently accepted medical use, and that has a low or moderate risk of dependence in abuse. And remember, I said that 27% of our membership supports rescheduling. So this speaks to those folks, and this may be a bill that they'll want to support individually. The only problem with this bill is that it does very little to alleviate the regulatory barriers to research. It leaves control of cannabis in the hands of the DEA. It will still require a prescription from a qualified healthcare provider, and it does little to remove barriers for access to patients. And then this was a quote that the Drug Policy Alliance posted regarding why moving it to a less restrictive schedule is not ideal. However, simply moving marijuana to a less restrictive schedule would not protect existing state medical marijuana programs or change federal penalties for possession, cultivating, or distributing marijuana. It would not prevent people from being arrested and punished for using marijuana. So let's take a little bit closer look then at why we as an association prefer descheduling and decriminalization to not rescheduling. Descheduling benefits include adults are free to incorporate medical cannabis into the management of their chronic conditions without fear of repercussion. Healthcare providers are able to openly discuss and recommend cannabis products without fear of repercussion. Safety and quality can be addressed nationally to guard patients. It opens the doors to research without prohibited costs, regulations that are currently in place. And most importantly, it follows the will of the people. Okay, so I'm going to stop sharing my screen now, and then I'm going to let you see my lovely face. Maybe. And here I am. So I see a lot of people just have their names up, and that's fine. I'm going to take a look at the questions and see what we have for questions. Looks like we have quite a few. All right. Lots of happy 402s, yay. Oh, thank you. Who was that said that? CN, who's CN? I don't know who CN is. I don't see. Somebody help me out.
Who said what, Jen?
Somebody said that Canara, oh, I'm sorry, you guys can't see this, sorry. Canara has updates on the More and Safe Bank Acts. Neither is going to be introduced until August, according to notes from Washington State. Washington State Liquor and Cannabis Board, April 2022 Executive Management Team meeting. Apparently this was just, oh, they put a link in here as well. So that's good to know. I'm not sure who CN is. Oh,
is that Wendy? Campus Wendy?
Yeah, it is. Thank you, Wendy, for that update. I appreciate that. And can I share? Here, let me share my screen so you guys can see that. How can I do this? She shared the link. How do I share it to everybody else?
Oh, they can look in the chat. They
Oh,
got
that's
it.
right. Okay. That's a good idea. All right. Can you speak to the scope of practice for the RN specific to education?
I can speak to that.
Thank you, Lou.
Okay, I'm very excited to announce that the credentialing committee has just finished the first final rough draft of the affirmation of focus practice. The affirmation of focus practice is a document that details the scope and standards of cannabis nursing practice. It's something that is put before the American Nurses Association, and it will provide details about the scope of practice for a cannabis RN, and we will be recognized as a nursing specialty. So that is in the works. It's currently finished in very rough format, okay? And it's going to be informally submitted to ANA, and they'll tell us whether it's a go or not, right? So I'm really crossing my fingers on this. I don't know for sure that it's a go, but I do feel like the document is a quality document. It's the best one that we have, and it covers everything. So just anticipate that there's more to come about that. And if we actually achieve specialty recognition status, then we can go for a more formal certification process where we can be certified, recognized by ANA, ANCC as a subspecialty of nursing. The other piece of that is that ACNA has recently gotten a position as an ANA affiliate. And what that means is that we have a seat at the table. We have a seat at the table where decisions are made in front of ANA regarding, of course, what we're advocating for is cannabis nursing. So I think we're moving in the right direction. The scope and standards hopefully will be approved. I can't say for sure they will though, right? It's still up in the air. And if they are, they'll be distributed soon. I'm sorry, that's my boy dog talking. And if they are not approved, then they'll go back to the writing committee and we will continue to pursue the goal. So that's about what I can state on cannabis nursing and the scope of practice and the standards and professional performance. All right, thank you for all the best wishes there.
Yeah, that was awesome. Thank you, Lou, for that update. I appreciate that a lot. And I'm sure everybody, what a great 420 message there that we get to hear. So that's good. Now, someone else asked, sorry, I was having trouble unmuting my screen there for a minute. So let me get my chat box opened again. So where was it? It was something about nurse practitioner. Let me find it. It was up here. Further up. Can I speak to about DEA licensing for NPs, specifically if NPs have to reapply for their DEA license in each state? I cannot speak to that. Is there anyone else that can speak to that specifically? Any advanced practice nurses out there that know what's going on with that particularly? Anybody raising their hand, or unmute yourself if you can. Well, I guess not, but I can look into that and see if I can see if I can dig anything up about that. Haley asked, how close is North Carolina from legalizing and decriminalizing and integrating medical cannabis? Do we have anybody from North Carolina? Our committee, so the government or policy and government advocacy committee looks at the federal level. We try to support our members at the state level if they need help, coaching on testifying at their state level. If they've got specific questions, we'll try to help them. But we just are not a big enough committee, unfortunately, to follow every state's legislation. I try to keep a pulse on what's happening, big events, but with 50 states, it's quite the challenge. So anyone else from North Carolina that can address that for her? Awesome, thank you, Amy. So Amy says that North Carolina does have a bill for medical that is likely to pass. So that would be awesome. So, all right, any other questions? All right, can you speak about the scope of practice for, oh, we already did that. How did that pop up again? Oh, I don't know why that popped up again. That was a question about education. That's all right, we'll forgive you. Person who posted said, oh, that was me. So somebody's asking if there's anybody else from New Jersey. Yeah, I agree with Haley said they passed a bill they pass a bill yearly. Hope this is the year it sticks. We can only hope. I know that there's a lot of people out there, the Debbie Downers, I like. We're like, it's not gonna pass. And I'm like, well, don't put that out there. Maybe it will. You just never know. So. Oh, okay. So Bradley Christian said he's from New Jersey. So whoever asked that question, if there was anybody from New Jersey, Virginia, meet Bradley. All right. So if there's no other questions, I'm not going to keep you on the line. I know people, it's evening time, dinner time for some, evening, people want to wrap up their evening and relax. So, oh, wait, here's another question. Do you have any resources to help research policies and bills from each state? So yes, and I am more than happy. We probably should post those links on our website. Is everyone familiar? What's that? You're mute.
Actually, it is on the website.
Okay. Oh, okay.
If you go under resources, it'll take you to a link to the federal government's site for state legislation, and you can find it there.
Okay, let me see if I can close that out and see if I can pull that out. Where did you say it was, Lou?
Okay, if you go to our website, there's a resources tab on the right-hand side in the top corner.
Okay.
And then under that drop-down box is a site that says something about the states. You might have to log in or not, I don't know. Let's see, medical cannabis programs by state, that very top one,
Oh,
Jen.
please, I'm just blind as a bat because I didn't.
It's only because it was the first one.
That's all right. That's exactly why. All right. Yeah. So there
And
it
if you
is.
scroll down, if you click on that link there, it'll take you right there.
There we go.
And that's the government link that's always updated.
Oh, that's right. So
it's wordy. There's
yeah.
no picture.
Yep. So all kinds of stuff
And I think maybe there's somewhere you type in your state and that'll take you there.
Awesome. Yeah, I was looking for that. I don't see it, but that's because I'm blind apparently today.
Well, you're on the spot too.
Yeah.
Oh, there we go. What's that,
that
right
it?
there? It's a map.
Yeah, but it doesn't work as it's not working as a clicker.
No, but it gives you color code at least.
Yeah, that's true. It tells us, yeah, and that's nice to know, because this is, you can go here, because there's so many websites out there that don't have they don't have updated information. Oh, here we go. Click.
There you go, yes.
Jump for get program information.
And the Education Committee just is posting a repository on the website under resources, which is an updated version of books and webinars and podcasts, et cetera, that are good resources for cannabis nurses.
Awesome. Let me go back here, change my screen display. Do that. I'm going to stop sharing. There we go. Okay. All right. Any more questions? There's people are posting some really good links in the chat. So I'm not so familiar with Zoom. Is there any way to preserve the chat so that we can?
Well, I believe it's being recorded, so you can probably pull it up in the recording.
Okay, great. That's, oh, Lindsay's shaking her head. Yes, we can do that. Awesome. All right. So
that's Jen, just so you know, and so that everybody else on the webinar knows, we'll be posting a handout that will have the slides from Jen's presentation today, and we'll also include the chat transcript for everybody so that they have it.
Great, thank you for that. One last question here. I'll answer this and then I'll let everyone go. What are the thoughts regarding nurses being fired for consumption? Interesting that you asked that, because we did put a position paper out and you can find it on our website regarding drug testing of nurses. And we actually know of one nurse who was able to get a job. She was a medical cannabis user. She was able to use our paper to convince her employer that he should hire her, despite her testing positive for cannabis in her urine. That's or awesome. In her urine. So that was huge. And so there's a lot of you out here hearing this. So please, I don't know what state she was in. It came to me third party that it had been used for this person. I wasn't given the name of the person or any details. It was just that we had a nurse who was able to use it. And really, that's all we really need to know. But I think it was awesome. So that resource is out there. So, you know, please use it. Please refer your coworkers to it as well if they're concerned about that. So. All right. Well, thank you, everyone. I'm going to go ahead and close the presentation at this point. And I hope some of you are going to be attending Patients Out of Time conference coming up in June. CANAMED is coming up in May. I know there's some people who are wanting to go to that. I wish I could go to both, but I can't. So, so maybe I'll meet some of you at point of Patients at a Time in June. So everyone have a safe spring and we'll talk to y'all soon. Bye.